Hi, my name is Emma Barjaki, and I'm here with Maze today. Maze is a 2-year-old intact female. She is a purebred border terrier. A little fun fact about Maze is that she is currently in the show ring. She does compete in the owner handling division with her great owner who is letting me borrow her for today. So I'm going to start with my distance exam while I have Maze on the table. During that, I'm just going to be looking at her body conditioning score. I'm going to be seeing if I can see a little hip or a little waist here. I'm going to be looking at her attitude towards me. Is she bright, alert, responsive? Is she a little nervous? Is she anxious? Is she a little bit aggressive? Because that would kind of dictate what approach I take if I start from behind and work up, or I start from the front and work back. So just looking at her real quick, she is kind of losing her waist a little bit, I would say. She's getting there a little bit around a 6 in my opinion. While I have her here, I'm going to be feeling her ribs, see if there's any fat pads over these areas, and I do still feel them. And I kind of can maybe see a waist still there, so I would give her about a 6. She's obviously very sweet and will let me pretty much do anything to her. So I'm going to start at the head and kind of work myself down in a systematic way. So looking at her face now, I'm going to be looking for any asymmetrical, make sure that everything kind of looks the same on both sides. Her eyes, her ears, her nose, her lips, those all look perfect. I'm going to start by looking in her mouth. I do always like to count my teeth. So I start with the canine, and we're at 4, 5, 6, 7, 8, 9. Sorry, Maze. See if I can see the 10. 10. Perfect. And I'll do it from the bottom also. 4, 5, 6, 7, 8. Sorry. 9, 10. I don't see any 11s, so maybe she got those taken out or she didn't have them when she was born. Also, while I'm in here, I'm going to be testing her, see if she's well hydrated, which she is. I'm going to be testing her capillary refill time, which is beautiful. Her teeth look like they are in pretty great condition. Maybe a little tartar starting to build up on her back molars and premolars, so I will talk to her owner about, just preventative dental care and keeping her as healthy as possible. Now looking at her eyes, again, symmetrical. I'm going to be testing her menace response now, which tests for cranial nerve number 2. So just going like this, making sure I'm not touching any of her hairs. She's got a very good response. I'm also going to be testing her palpable reflex. So just touching here, making sure, you can yawn, that's right. Making sure that her eyes are blinking, and this also tests my cranial nerve 5 and 7. Also, if I had an ophthalmoscope, I would look into her eyes, shine a light, and see if I can get her pupil reflex, and that would also test my cranial nerve number 2. So keep going on with that. I'm also going to be looking at her conjunctiva, making sure there's no redness, no swelling. It looks pretty good. I do know she has been through a lot this last week, so I think it's a little irritated. I will now also get her third eyelid out if I can. Here's her third eyelid. Still a little red, poor girl. I think it's just after a lot of touching. Looking at her globe, we're pulsing that. Everything looks good there. So moving on, my eye exam, I would say, is nothing significant. Maybe just no more exams for you. Now going into her ear. They are, as we know, an L-shaped ear canal. So I would have my otoscope and kind of put it into her canal in a downward position to really open up and see her inner ear canal. So since I don't have a light, I can't really see too much, but from the outside, it looks good. There's no hair, there's no debris. I like to smell, make sure I can't smell any yeast in there, and that smells perfect. I know her mom does groom her, so I think she's doing a great job. That's it for my face exam. Everything looks good here. Now moving on, I am going to just As I'm not really doing too much with her, I'm just gonna look at her breathing, see if it's elevated, see where she's at, and get my time just by looking. So I count for 15 seconds. And that's how we get her resting heart rate. And now looking, I'm going to listen to her heart first, and then go into listening to her sound of her chest a little bit better. Sorry, she can stay sitting. Actually, okay, so. While I'm here, I'm also going to be getting her heart rate. So I got around 50 beats per minute, which I think is pretty accurate for where she is. She's very calm, not going crazy. While I was doing that, I was also able to get her resting respiratory rate, which I got to be around, I think it was 16, sorry, math. So again, a little low, but I think that's just because she's not doing much, so I'm not worried about that. Now I'm going to go into listening to her 4 quadrants of her chest, and then I'm going to also listen to her trachea area and make sure there's no upper airways getting affected. So take my time. Sorry. Good breath. Good girl. I'm just gonna listen to here. And everything sounds great. From time's sake, I would also do that on the other side, same method, 4 quadrants, and listen to her heart valves on that side. I didn't hear any murmurs or any arrhythmias. She seems like she's in really good health there, so kudos to mom. Now I'm going to go into, no, she's not gonna like this saying. I'm gonna go into my abdominal palpation. So I'm gonna start very cranial right after her last rib. And I start low, and I'm just gonna be working my way up. Feeling everything. Eventually I will be able to feel her intestines, her kidneys if I really wanna get up here, and her bladder, which is now where I'm getting to. I like to change my hands when I get to the inguinal area just so I can, especially with a little dog, so I can feel her bladder and hold it in my hand, which is pretty small. I think she just peed, so that's good. Also, since giving her history, I know that she's intact. While I'm down here, I'm also going to be feeling her mammary glands. I just want to make sure that there's no bumps or hard lumps, make sure that they're both pretty symmetrical, or they're all symmetrical. I know recently that she came out of a heat, so it's still maybe a little swelling, but they all feel pretty good. Awesome. And also while I'm back, I'm just gonna look at her vulva area, make sure that's not swollen or tucked, and that looks beautiful. Awesome. Great. And then also while I'm back here, I'm gonna be feeling her femoral pulses and make sure that I can feel those nice. Usually you would wanna listen while you're feeling them, which I will do, just to make sure that her pulses and her heart kind of match up. So do that real quick. She feels great. So that was great. Also, just to start again, I am going to be feeling her lymph nodes all over while I'm still here. So I'll start at her submandibular, which are fine, her pre-scalps, which cannot feel at all, which is great. Her inguinal, her axillary ones, here, well, and then these guys. So nothing here, which is good. No swelling of her lymph nodes. Everything looks great in that way. I'm also now, just to keep going, going to check for any back pain I may feel or just any uncomfortable in her back. I like to press a little hard, and she seems good. That's good that she sat. That's a reflex. So she looks great there. Also continuing my little neuro exam in orthopedic. I'm going to test her reflexes here, her proprioception. That's beautiful. We do it in the front and the back because it helps you localize where the lesion could be, if her front has it and her back doesn't, vice versa. Sorry, one more. Great. And that's perfect. She looks great. So just going to give her a feel once over. Also during my exam, I'm just going to be checking her skin, make sure that there is no redness, no itchiness. In the history, she was just here for her wellness, so mom didn't say anything about any itching. Her paws look good. There's no redness, no signs of excessive grooming. I'm sorry, yes, sorry. Good job. So now while she's in this position, I am going to test my cranial draw. So starting with my landmarks, I'm going to be having my hand on the patella and the fibia right here, and then the tibia tuberosity in the head of the femur. So, sorry, this is not the way I like to do it. Sorry, Maze, I need to flip you. I'm sorry. It's easier with the other hand. Sorry, Maisie. Oh, okay. Sorry, you're good there. So again, my patella and my fibia and my tibia tuberosity and the head of my femur. So I'm gonna keep this one straight and this smooth. And there's nothing here, which is good. Everything looks great there. No overextension, no popping. It didn't hurt her, obviously. I didn't feel any decrepisis. So that looks good there. And that's all for today. I would also get a rectal temperature, make sure that that's normal, keep that in her record. So God forbid she does have a fever, we can kind of see what normal is. I will be talking to mom about maybe her diet, what she's eating, her exercise level, just so we can keep her weight as is and at show level. And that's really all for today.